Sinus issues are very common. The best estimates are that about 10% of the U.S. population suffers from sinus disease at some point during their lifetime. And an important subset of these patients have chronic sinus disease, and even a smaller subset have nasal polyps. And these are the most difficult conditions. And think of this as a cold, except it's a chronic cold that can linger for patients for years.
Sinus disease in particular will usually present with congestion. There actually may be some facial pressure. It affects so many people in different ways. They often don't seek care. Patients primarily experience a reduction in their productivity, meaning that they miss work or they show up to work while sick and try to plow through it.
Patients with chronic sinus disease have a much higher prevalence of depression, sleep problems, fatigue. This is more than just a stuffy nose. It is a chronic disease, no different than Parkinson's or heart disease or asthma or other chronic conditions. The good news is there's a whole array of treatment options, be it medications and often innovative surgical techniques that can be of great benefit to our patients. Our key approach is patient-centered, and I think that's really critical to optimize outcomes. When you come here, you're not just seeing me, you're going to see potentially a whole host of colleagues across the institution to really provide multidisciplinary coordinated care. And I think ultimately, to give our patients the best outcomes, that's really important.
I very rarely just see a patient first and say, oh, you need surgery. No, there's often or almost always a trial of optimal medical therapy. And that can range from some allergy medication to some antibiotics as well.
Majority of the time, patients come to me for a second opinion or their 10th opinion for their sinus disease.
Sometimes in patients with very severe disease, if they don't have the right operation up front, it can lead to them having a revision surgery in the future. We have expertise in treating patients that have failed prior surgeries. About 50% of our practice are patients with revision surgery.
One of the things that I think it's important for patients is we want to restore health. And also to let them know that they know somebody's going to be looking over this disease process, managing them, following them closely, and know that they're going to have a partner so they can feel better and restore and regain health.
I actually follow all of my patients, through life, even after I've had surgery on them. Just because you've had surgery does not mean you're cured.
This is something that will require ongoing commitment and long-term medical management. So that's one of the most common misconceptions about the disease and the treatment. And that's only going to be successful if there's a buy-in from the patient.
I love what I do because this is one of the fields where you can really really impact a patient's quality of life.
They touch you, they change you, they change the way you practice medicine, and I think it's that human aspect of patient care that ultimately drives me to do what I do.